Hello, and how are you? My name is Winnie Berawa. Welcome to my YouTube channel where I cover lessons, lectures, and expert interviews relating to healthcare. If this is something that you like, kindly remember to give us a subscribe and watch all the way to the end. So in this lesson, I'm going to focus on the investigative procedures and the tests that are done for respiratory disorders. So in this first class, I will introduce just basic what the procedures are, and then in the following classes, we're going to explore each and every procedure in details. First of all, respiratory disorders, these are diseases that affect the respiratory system, and that could include all the way from the nose, heading downwards to our pharynx, to the larynx, to the trachea, bronchus, to the lungs, and its surrounding environment. That is the pleura, the muscles around it, the airways, all the way to the smaller airways, and finishing up in the alveolus. But in the procedures that we can perform, we can have non-invasive procedures, meaning these are procedures that don't need us to access the vascular systems. We don't need to introduce cuts or withdrawal of blood samples. So for example, we have the first procedure, which is clinical history. This is basic history, analyzing the symptoms, getting to understand what the patient complains about. Then you have physical examination, and this is performing the proper physical steps of the chest. That is in terms of the inspection, palpation, percussion, and auscultation. We've done a whole video on this, on physical examination on the respiratory system. Then you have the pulmonary test, that is looking at the peak flow meters, the spirometry, and all that. We will discuss this also in details. Then we have radiological and imaging techniques covering techniques like the MRIs, the X-rays, CT scans, and so on. Then we have the exercise testing. This is mostly combined with cardio systems, so we call it the cardiorespiratory exercise test that explores the different changes that comes when the patient is either walking, running, or performing different exercises. Then we have pulse oximetry. We have microscopy, focusing more on the secretions. This is mucus and analysis of it, be it in form of culture and sensitivity, be it in form of assessing of its appearance, texture, flow, and so on. And the second category of procedures for the respiratory system disorders are the invasive procedures. So here we look more into the laboratory methods, that is, for example, the serology tests, the dynamas, arterial blood gases, and even skin tests. For example, the tuberculin skin test that will help us when it comes to evaluating TB existence in the system. So in this case, invasive simply means procedures that allows us to access the tissues or to access a blood system so that you can be able to evaluate the different pathologies that are present in our respiratory systems. And lastly, this is the last category for the respiratory procedures. We have the special procedures. These are a bit more specialized. They require someone to understand how to actually prepare for them. The pre-procedure, the intra-procedure management, and even the post-procedure management. So they have more detailed way on how to handle them. So here we will cover issues on bronchoscopy. We will look at bronchography, thoracentesis, that is the procedures that allows us to aspirate or access the fluids that are located in the pleural space and analyze it and use it for different samplings. Then we have the lung biopsy. This is accessing of tissues that can be explored for different tissue exploration purpose. Maybe it could be sensitivity and culture. You can do it for lung analysis cases. Then we have thoracoscopy, we have bronchoalveolar lavages. Then there's cases of pulmonary and bronchial angiography, looking at the blood supply around the area. So all these are special procedures. And like I said, we will explore them in details like in the next lesson. So keep it here. This is just to introduce you like the many procedures that are involved when it comes to respiratory disorders. So for example, in bronchoscopy, you can see this is analysis or checking on our airways using a tube or a very flexible tube known as the bronchoscope. And then we have cases of the thoracentesis, where you want to access the pleural space to aspirate fluids that have accumulated there, using a needle. And in other cases where we talk about biopsies, basically you get a fine needle that accesses the tissues there, and you're able to scoop or to cut a small tissue sample for use in the laboratory for finding pathology in the different regions. And so if this is the kind of knowledge that you love, this is the kind of channel that you enjoy, please give us a subscription, a comment, share, and remember to like our video. Thank you so much, and see you in our next lessons. Bye.